call this Board of Health monthly meeting to order for Wednesday, May 14th at 5 p.m. Can we call the roll, please?
Danielle Chenoweth.
Present.
Jennifer Locke.
Present.
Kyle Patterson.
I would entertain a motion to approve the agenda.
So moved.
Second, any discussion? All those in favor say aye. Aye. Opposed, that carries. Next, I'll entertain a motion for approval of the minutes of previous meetings, April 9th, 2025.
So moved.
Second, discussion. All those in favor say aye.
Aye.
Aye. That carries. Next, we have public, excuse me, I'm sorry, I ended up getting out the way here. They have public participation. Looks like we only have staff in the room. Correspondence, Julie is out. Any correspondence from staff? Leadership, thank you. Old business, we don't have any new business. We would hear from the treasurer.
For March 2025 financial statements, that we showed cash on hand on March 31st at $7,506,779. The total fund balance was just over $8.2 million, representing 48% of the budgeted expenditures for the year. We ended the 9th month of the fiscal year with a surplus of $849,266. That was against a budgeted year-to-date deficit of negative $704,766. Total revenues for the 9 months of the year was $10.9 million, or $1.1 million under the year-to-date budget, made up mostly from grants and contracts that have not yet come in. Total expenditures were at $10,086,339, or $2.67 million under year-to-date budget. Mostly out of the personnel being under budgeted by $1 million, fringe benefits by $614,000, supplies under budget by $207,000, and capital outlays under the year-to-date budget of $713,000.
Any questions about the financial report? Things look healthy.
I move to accept it.
Okay, motion to accept, a second. All those in favor say aye.
Aye.
Aye. Opposed, that carries. Next, I'll take an omnibus fashion if it's okay, Ruth. I do. Approval of payments to Board of Health appointees, Treasurer Ron Fields for April 2025 services, Attorney Ruth Wyman for legal services March 15, 2025 to April 15, 2025, and Administrator Julie Bright for mileage reimbursement from ISPHA meeting in Springfield, Illinois. I'll entertain a motion.
So moved.
A motion, I'll second. Any discussion? All those in favor say aye. Aye. Opposed, that carries. Next, we have a review of the monthly credit card statements. Give me a second just to run down to here. Do you have any questions? Sorry, I usually look at this in advance. I'm just going to take a minute to look at it. It has been a day. Is everyone eating? Okay, yeah, I don't have any concerns or questions.
I move to accept.
Motion to accept, a second. All those in favor say aye. Aye. Opposed, that carries. Next, we have the designation of the budget document for fiscal year 26 as the tentative budget and appropriation ordinance. First, we'll take a motion and we can have discussion.
So moved.
Motion, I will second the motion. I think the process is that we put this on for 30 days and then there will be a public hearing and then it'll be approved. I wonder if there's any statements that staff would like to make about changes to the budget this year that the board should be aware of.
Pretty much the same as last year. Of course, everything's up in the air, but so we left everything as flat funding. Wage increases are 4% according to the bargaining unit contract. Everything pretty much the same.
Can I ask, has there been any cancellation of contracts, federal contracts that affect us to date?
Not yet. We've had a couple of maybe, but they're still being fought, so.
Okay. And there's nothing that And everything is basically, if we lose federal funding in one area, then we cut the expenditures in that area, or we find some way to replace the funding.
I think it's gonna depend on what it is that happens.
Yeah, if you could just keep us apprised of the situation. I mean, we do, I would just say in township, it's a similar kind of like, we've got some surplus that we can use to float situations, and so I just encourage us, if we're looking at some cut due to federal instability, that perhaps the board could be involved in whether or not it makes sense for us to cut that program or use some of our surplus to float it. So I would just, I know Julie's not here, but I'd probably want to know before we were going to cut some significant piece of our programs.
She had already talked about that, so
Okay.
she will keep you in the loop for sure
Okay,
if that happens.
great, yeah. And let the record know, show that there's a budget highlights, we could go over the budget highlights. But it looks pretty standard. We were looking for a deficit budget of 1.7 million, so we're doing some spend down. And there's a capital outlay of $1 million of that, which I assume is $1 million of that 1.7 million. Yeah, let's see what else. We'll have a monthly, didn't we?
Yeah, I had a chance to look at it, and what I really, it's weird for me to see a healthy fund balance.
Yes.
So that was very nice.
Well,
And so that's what,
helps.
I know, it's great. Yeah, so the just for anybody, you know, to see or whatever, the fund balance being up so high is why we're gonna be able to put the money towards capital improvements and IMRF spending, and that's all necessary things, so it's great. And the healthy fund balance means that, yeah, we should have that conversation if something gets cut.
Mhm.
But otherwise, I really like looking at a healthy fund balance.
It's
Keep
great.
it up.
Yeah. Okay, so we had a motion and a second for the designation. We're not voting on the final budget at this point, but I think we'll just take a vote on the designating it and put it on file. So all those in favor say aye. Aye. Opposed? That carries. We have approval of the lease agreement with Promise Healthcare. Is that for our location?
It is. Currently, that space is being used by Avicenna, but it's only being
Oh.
used on Sundays.
That's right.
But Promise is wanting to move in there and partner with our maternal and child health and doing some work for them, with them.
That's awesome. Yeah, if you could just keep us apprised of it so that we can make referrals, that would be great. Do you happen to know if the rent is paid for, is it like new grant money from Promise Health, or is it,
I don't know.
it's not a whole lot, it's like 20,
We're
What is
charging
it,
$1 a square
2,300?
foot, so.
each month, so. And Avicenna, it will leave, or they'll just operate on Sundays?
Well,
They're figuring it out.
we are not renewing their lease, but if they want to work out an arrangement, they can do it with Promise, because
Okay.
it's Promise space, so.
Yeah, and what's Avicenna been paying? Has it been basically a nominal fee, or have they been paying?
Yeah, $1 a square foot, and they were only using like 700 square feet of the space.
Okay, so they're paying 700,
Mm-hmm.
and then they'd be paying, so this is actually an increase for us in activity and money. Yeah, it was aware that we were moving in this direction with Promise and Avicenna.
So moved.
We have a motion, I'll second it. Any discussion? All those in favor say aye. Aye. Opposed, that carries. Next, I'd entertain a motion for the approval of requisition payable to Securitas Technology for additional sensors for the alarm system.
So moved.
Second, any discussion?
I guess I just have one clarifying question for anybody that might be in the know in here. It's $5,876.95, but there's going to be a fee later when we figure out what the permit situation, is that accurate? If I was reading in the contract, it said plus permits, but that has to be figured out as it goes. Is that, do we have any idea when we would find that out? It's probably a Julie question.
Yeah.
So if we hear about later additional fees, that's fine, because they let us know.
Okay. Yeah, I don't have concerns or questions. All those in favor say aye.
Aye.
Aye. Opposed, that carries. Next, we have approval of check request payable to CS Construction Group LLC for MCH office wall build.
So moved.
I have a motion, and I will second that. And please, MCH is maternal and child health.
Yes.
Okay. And then, was there a screen that was done on the, I didn't see one, like it was done the previous month before? Okay. Oh, okay.
Or the month before that.
Any other discussion? All those in favor say aye.
Aye.
Opposed, that carries. Next, we have approval for check request payable to Service 51 for congenital syphilis prevention campaign.
So moved.
Second, any discussion? All those in favor say aye.
Aye.
Opposed, that carries. Next, we have approval of check request payable to Zobrio for financial edge and XT client care agreement from July 1st, 2025 to June 30th, 2026.
So moved.
Second, any discussion? All those in favor say aye.
Aye.
Opposed, that carries. Next, we have approval of requisition payable to NASEN for Dance Safe xylazine test strips.
So moved.
Second, any discussion? All those in favor say aye.
Aye.
Opposed, that carries. Next, we have, what did I have? Oh, thank you. Approval of check request payable to McCormick Service for HVAC replacement.
So moved.
Second, hold on. This is total HVAC replacement, let's see. It's 25,000. Is that right? 25, page 25. And is this like a project in process? Or is it a new project?
That also was part of one of Jim, they packed this,
Jim's from last packet, I have to look.
Yeah.
I remember McCormick,
yeah.
so, okay. All those in favor? Aye. Opposed, that carries. Approval of requisition payable to Cencora for medical supplies.
So moved.
Second.
Actually, that one is a ratification now.
Oh, yes, that's right. Approval to ratify the requisition already paid to Cencora for medical supplies. I will revise and make that motion if you'd like to second it.
I will second that.
Okay, the motion is second. Any discussion? They ran out and I need to approve the bids. That's the first.
That's good.
All those in favor say aye.
Aye.
Opposed, that carries. Next, approval of travel request for staff to attend the NACCHO conference in July 2025.
So moved.
Motion, I'll second it. I think we're looking at 3 staff members for hotel conference registration and meals. Any discussion? All those in favor say aye. Aye. Opposed, that carries. Next, we have approval of service agreement renewal with Dental Imaging Technologies Corp. For dental equipment.
So moved.
A motion, I will second it. Any discussion? I mostly wanted to see if it was an addition of a service, or if it was a renewal of an existing service. Digital Imaging Technologies. I think this is renewal, it already says that in the motion. All those in favor, say aye.
Aye.
Aye. Opposed? That carries. And we have pending grant contracts for the administrator to sign. No? Okay, just these from before. With there being no further business, our next monthly meeting will be June 16th from 2025 at 5 p.m. That's rescheduled from June 11th, so mark your calendars. New time, June 16th. And I'll entertain a motion to adjourn.
So moved.
Second, all those in favor? Aye. We
Aye.
are adjourned. Yep.
That was exciting.
And we're moving on to the board.